Robert F. Kennedy Jr. has officially stepped into the role of Health and Human Services Secretary under President Donald Trump. This appointment marks a significant shift in public health leadership, bringing with it both anticipation and apprehension. Kennedy, a well-known environmental activist and lawyer, has been a controversial figure due to his outspoken stance on vaccines. His confirmation hearing was met with intense scrutiny, reflecting the deep divisions surrounding his views. The Senate ultimately confirmed Kennedy by a narrow margin of 52 to 48. Republican support remained largely unified, with all but one senator voting in favor of his appointment. Democrats, however, stood firmly opposed, citing concerns over Kennedy's stance on vaccines and its potential impact on public health policy. Senator Mitch McConnell, a polio survivor, broke ranks with his party, casting the sole Republican vote against Kennedy's confirmation. As HHS Secretary, Kennedy will oversee a vast department responsible for $1.7 trillion in federal spending. This includes a wide range of crucial areas such as vaccine recommendations, food safety, and health insurance programs. His leadership will undoubtedly shape the direction of public health policy in the coming years. The nation now waits to see how Kennedy will navigate the complex challenges ahead and what his tenure will mean for the health and well-being of all Americans. Kennedy's stance on vaccines has been a focal point of debate throughout his confirmation process and remains a topic of intense public interest. A long-standing critic of current vaccine practices, Kennedy has raised concerns about potential side effects and advocated for increased transparency in vaccine development and testing. While acknowledging the vital role vaccines play in public health, he has consistently maintained the need for rigorous safety protocols and thorough investigation of reported adverse events. One of Kennedy's first actions as HHS Secretary was to announce the launch of a comprehensive program dedicated to monitoring and investigating potential vaccine side effects. This initiative aims to establish a robust system for tracking, analyzing, and responding to adverse events reported following vaccination. By enhancing surveillance efforts and improving data collection methods, Kennedy hopes to address public concerns and foster greater trust in the vaccination process. Central to this initiative is the creation of a publicly accessible centralized database where individuals can report any suspected side effects experienced after receiving a vaccine. This database will serve as a valuable tool for researchers and healthcare professionals to identify potential trends, patterns, and anomalies that warrant further investigation. By making this information readily available to the public, Kennedy aims to promote transparency and empower individuals to make informed decisions about their health. Beyond vaccines, Kennedy has outlined an ambitious agenda for addressing the growing burden of chronic diseases in the United States. Recognizing the significant impact of conditions such as heart disease, cancer, and diabetes on the nation's health and healthcare system, he has pledged to make tackling these challenges a top priority. A cornerstone of this effort is the formation of a dedicated commission tasked with conducting a comprehensive review of current approaches to chronic disease prevention, treatment, and management. This commission will bring together leading experts from various fields including medicine, public health, nutrition, and environmental science. Their collective expertise will be crucial in identifying gaps in current knowledge, evaluating existing programs, and developing innovative strategies for preventing and mitigating the impact of chronic diseases. The Commission's findings and recommendations will play a pivotal role in shaping future policy decisions and guiding the allocation of resources towards effective interventions. Kennedy's focus on chronic diseases stems from his belief that a paradigm shift is needed in how we approach healthcare. He has argued that the current system, largely focused on treating diseases after they develop, is unsustainable and ultimately ineffective in improving long-term health outcomes. Instead, he advocates for a more proactive approach that emphasizes disease prevention, early detection, and lifestyle interventions. Kennedy has also signaled his intention to implement significant reforms within key health agencies under the HHS umbrella, including the National Institutes of Health, the Food and Drug Administration, and the Centers for Disease Control and Prevention. Citing concerns about bureaucratic inefficiency, lack of transparency, and potential conflicts of interest, he has called for a comprehensive overhaul of these agencies to enhance their effectiveness and restore public trust. One of the most significant proposed changes is a major staffing overhaul at the NIH, with Kennedy aiming to replace a significant portion of the agency's leadership. He has argued that this move is necessary to bring in fresh perspectives, challenge entrenched interests, and foster a more innovative and results-oriented culture. This proposal has been met with mixed reactions, with some applauding the bold move while others express concerns about potential disruptions to ongoing research and the loss of institutional knowledge. At the FDA, Kennedy has pledged to prioritize expediting the drug approval process while maintaining rigorous safety standards. He has argued that the current system is too slow and cumbersome, hindering patients' access to potentially life-saving treatments. To achieve this, he has proposed streamlining regulations, increasing transparency in the review process, and fostering closer collaboration between the agency, researchers, and pharmaceutical companies.